Frustrating as we start to see our clothes no longer fit as women move into middle age, and even more so when diet and exercise don't seem to help and you feel lethargic and unmotivated.
In tonight's Weight Loss Wednesday, medical reporter Meg Farris has some answers.
Think about increasing hormones at puberty. They completely change your body from straight to curvy. Hormones cause fat to go to the chest, hip, and buttocks areas. Now think about that in reverse. At menopause, the ovaries decrease production of hormones.
Did you notice your body changing or gaining weight?
Oh, dear Lord. Yes. And I just started gaining weight, and my skin changed, you know, just like the body composition changing.
At 54, Christy Cass is a busy, energetic entrepreneur and marketing director. But a few years ago, menopause made her miserable, body, mind, and spirit.
I had no energy, no focus. I feel like I lost my brain. Really, it was just flat. I was always a pear. I always had the bigger hips, bigger thighs, all of that. Never had a stomach. Holy cow, now I have a stomach.
So Christy sought help from advanced gynecologist and hormone replacement expert, Dr. Stephanie Schultes.
Mood changes, worsening of anxiety, worsening of depression, weight gain, and even in those people that are working out consistently, and that's very frustrating for them. Fatigue, decrease in sex drive, decrease in sexual pleasure.
Dr. Schultes says there are short-term and long-term effects to your health without your estrogen, progesterone, and testosterone. Yes, the male hormone, all made by the ovaries. There's faster loss of bone, muscle, and brain, faster formation of plaque clogging the arteries. All the skin and genitals become more lax with more urinary infections. Fat accumulates in the dangerous area around the waist.
It's the fat around the liver, it's the fat around the kidneys, the intestines, and that's very unhealthy fat. And we know that starts accumulating more with the lack of estrogen, and that leads to insulin insensitivity, and that leads to potentially fatty liver.
She says estrogen improves your metabolism, and testosterone preserves your muscle and energy, all leading to burning more calories and not only having the energy to work out, but seeing results.
A lot of studies are actually showing this now, that you can't ignore the menopausal transition and the hormonal changes that occur as a time for significant weight gain for some women. Reintroducing estrogen back into a woman's life actually helps to stop that fat redistribution.
Section head of Oxnard Baptist OBGYN and hormone replacement expert, Dr. Jennifer Brunet, says replacing testosterone is also important.
Not only does it help their mood, and it helps a lot of times their marriage or their relationships, but it is going to increase their lean body mass. And by increasing your lean body mass, you're increasing your metabolic rates.
The testosterone is the bomb, just saying. That first month I was like, holy cow, girl on fire. Christy is back, let's rock the world.
Christy gets non-oral bioidentical HRT from Dr. Schultes, a tiny implant under the skin that slowly delivers hormones to her blood, just like her ovaries used to. She also treats men in andropause and says they see the same fat redistribution benefits from HRT. And Dr. Brunet notes that the added benefit of HRT after menopause is hormones restore that drop in brain chemicals responsible for feeling pleasure, satisfaction, and motivation, making you feel like getting off the sofa and moving.
Is it a cure-all? Is it nature's wonder medicine? No, but it definitely can assist women in achieving their weight loss goals.
For Weight Loss Wednesday, I'm Meg Farris. Now, Dr. Schultes adds that unfortunately, the biggest hormone study done more than 20 years ago misrepresented the association of hormone replacement with the increased risk of breast cancer. She said there was never a significant increase. Now, she encourages a conversation with a medical doctor who specializes in HRT about your personal medical history. And it's important for the doctor to get your regular blood level results to know the right dose to give to you.
All right, important.